This is part 3 of the chapter 6 lecture notes, and we left off on this slide on osteopenia and aging. Osteopenia is actually inadequate ossification, and it's related to estrogen and testosterone levels. Women lose about 8% of their skeletal mass each decade. Men lose about 3%, and this is due to the levels of estrogen and testosterone as we get older, um, loss of them. And osteoporosis is actually a more extreme or more severe form of osteopenia. Okay, bone markings. This can occur on the surfaces of bones, and sometimes they're called surface features, but they can be elevations, processes, or projections. Elevations, processes, and projections are places where they're raised areas of the bone, and they're areas where tendons and ligaments attach, or where bones articulate, or where they come together and form a joint. Depressions, grooves, and openings are indentions in the bone, basically, and or openings in the bone, and that's going to be where blood vessels and nerves pass through the bone. The skeletal system consists of 206 bones in total. There are two parts of the skeletal system: the axial skeleton. If you think about the axis of the body, is the skull, the rib cage, and the spinal column, or the vertebrae. And then the appendicular skeleton is going to be the upper and lower bones, bones of the upper and lower appendages, as well as the pectoral and pelvic girdles, which is your hips and your basically your shoulder girdles. And I'm going to go over all of the bones with you, but I'm going to use a different figure. So the axial skeleton consists of 80 bones, and that would be the bones of the skull, which includes 8 cranial bones and 14 facial bones. The ear bones are called ossicles, and there are 6 ossicles. And then the hyoid bone. And then bones of the thoracic cage, which are your ribs and your vertebral column. These are all of the bones of the axial skeleton. And this just lists functions of the axial skeleton. Okay, and these are, I'm hoping there's a better, guess not. Okay, so we're going to go back to the picture of the skull bones and just go over them, but I'm going to blow it up a little bit for you. So starting with the bone of the forehead, this is easy because remember the frontal region was the forehead region. So we just call this the frontal bone. This is called the frontal bone. And then just posterior to that are 2 bones called the parietal bones. They would form the top of your head. This is the most superior portion of your head. And then you have this red bone here. You have one on each side called the temporal bone. And the temporal bone extends down near the ears and has a chunky little process here called the mastoid process, which muscles of your jaw are attached to. And then we have the purple bone that kind of goes back all the way. It starts between your temporal bone and your frontal bone, and it goes through your skull, basically. And it is called the sphenoid bone. And then we have the nasal bone. There's 2 nasal bones. The green bone here is the ethmoid bone. Your cheekbones are the zygomatic bone. The upper jawbone is the maxilla, and the lower jawbone is the mandible. And then back here in the orbit, we have, well, we already said sphenoid. The yellow bone is the palatine bone, and the green is the ethmoid, and then the orange bone is the lacrimal bone. I'm sorry, it is not the lacrimal bone. The orange bone is part of the maxilla. The lacrimal bone is shown here as kind of a, it's this bone on each side. It's kind of a deep red. It just looks black here. So those are the bones of the skull. You can see some of them from a different point of a different view. Sorry. Okay. I will talk to you about, I'm going to skip some of this stuff, but I am going to, because it's just so much information. But if I go over it, then you need to know it. So the sinuses are air-filled cavities within the skull bones. They're lined with mucous membranes, and they reduce the weight of the skull. There are sinuses in the frontal bone called the frontal sinuses. You should know of here in the sphenoid bone is a depression called the sella turcica. And the sella turcica houses the pituitary gland. Which is right here. So the sella turcica is a depression in the sphenoid bone, and it houses the pituitary gland. And the pituitary gland produces a lot of hormones. It's a very big component of the endocrine system. Another thing about the sphenoid bone is it forms part of the floor of the cranium. So it acts like a bridge between the cranium and the facial bones. And that's the sphenoid bone, which is this, if you look at the, if you look at, if you were to take and do like a transverse section through the skull, the sphenoid bone, it often gets described as like the shape of the Batman symbol. It's the purple bone that goes, that is actually between your cranial bones and your facial bones. And it does have a depression where the pituitary gland sits. Okay, then got the, okay, so we had the frontal sinuses. We also have sinuses within the ethmoid bone called the ethmoidal sinuses. And we have the maxillary sinuses in the maxillary bone. Zygomatic bones are the cheekbones. Okay, and here is a picture. I've been trying to talk about all the different sinuses, and this is actually an illustration that shows you where all of the sinuses are. We have sinuses in the frontal bone, sinuses in the maxillary bone called the maxillary sinuses, and then we have the sphenoid sinuses, the sphenoidal sinuses. And they're all together called the paranasal sinuses. They drain into the nasal cavities. The mandible is the lower jawbone. The hyoid bone is not attached to any other bone, so it's kind of suspended there. Here's an illustration of the fontanelles. They close and become the frontal and sagittal and coronal sutures in the adult. The vertebral column consists of 24 vertebrae, and then the sacrum and the coccyx. There are 7 cervical vertebrae, C1 to C7, 12 thoracic vertebrae and 5 lumbar vertebrae, and then you have the sacrum, which is 5 fused vertebrae, and the coccyx, which is the tailbone. Um, and a lot of times you remember the number of bones in each subdivision based on the times that you eat. So at 7 a.m., we eat breakfast. At 12, we eat lunch. And then this is really early for dinner, but we're just going to pretend that we're elderly and we eat at 5. I don't mean to make fun of the elderly, but I actually, I'm making fun of myself because I eat early a lot of times, just because I like to go ahead and cook and get it over with. But anyway, remember 7, 12, and 5, and that's how you can remember that there are 7 cervical vertebrae, 12 thoracic, and 5 lumbar. And you can see a picture of them right here. C1 through C7, the vertebrae in your neck, and then the thoracic vertebrae in your chest, and then the lumbar vertebrae. And they kind of curve in a different direction. The cervical vertebrae curve more toward your ventral region or anteriorly, and then the thoracic has a kind of a posterior curve, and the lumbar has a more of a ventral curve again, and then the sacrum curves posteriorly again. So there are a few that are important. We need to talk about abnormal spinal curvatures. Kyphosis is an exaggerated thoracic curvature. Lordosis is an exaggerated lumbar curvature. My mother used to call that swayback. And scoliosis is abnormal lateral curvature. We will talk about a few of the markings on the vertebrae. When you feel the bumps along your spine, like when you press against the skin of your back and you can feel those bumps, those are caused by the spinous processes of the vertebrae. So, which is this right here. So those are what cause the bumps along the midline of your back. And the spinal cord goes through the intervertebral foramen. A foramen is a large hole, so the vertebral foramen is where the spinal cord goes through. There are a few important vertebrae. C1 is the atlas and C2 is the axis. So the movement called that we when we are nodding yes to someone is the movement between the atlas and the occipital bone. And then the movement when we're shaking our head no is between the atlas and the axis. Okay, the ribs, we have 12 pairs of ribs, and then we have a breastbone. And the breastbone is called the sternum, and it consists of the top portion is called the manubrium, and then the body, and then the xiphoid process. And the xiphoid process of the sternum is the part that gets broken commonly during CPR. Now, the first 7 pairs of ribs are called the true ribs, and that is because they are connected to the sternum directly by costal cartilages. But then you have the false ribs, which are pairs 8 through 12. The last 2 pairs 11 and 12, are floating ribs because they aren't connected to the sternum at all. And then pairs 8, 9, and 10 are the false ribs that are connected to the sternum indirectly by cartilage. It's like a piece of cartilage connected to another piece of cartilage. Whereas if you look up here at the true ribs, they're connected only by one piece of cartilage to the sternum. Okay, so true ribs are 1 through 7, false ribs are 8 through 12, and then the floating ribs are 11 and 12. And that's in these notes right here. And then the different portions of the sternum, the manubrium, the body, and the xiphoid process. I'm just scrolling through the We've seen this so many times, so let's